Hello and welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. I've worked over 9 years in utilization review, also known as utilization management, and I've worked for 3 different companies, and I've also only worked 2 years at the bedside. So this first company is called Allscripts. They're looking for a RN med refill. In this position, I always go straight to the qualifications, and even if you don't meet all the qualifications, just apply anyway. You just never know. So the qualifications for this position is, well, actually this is benefited a full-time position, working Monday through Friday, 9 a.m. to 5:30 p.m. Hours will vary as needed. The position is fully remote, and you may do some training on-site in 4S Ranch. The job doesn't say exactly where 4S Ranch is located, and they tell you actually what you'll be doing, and I don't see the qualifications for this one. So you must be an RN, and I'm guessing this is probably you'll actually work in or near San Diego, California, and this is once more full-time job, and you may do training on site. So the next company we'll go to, this is Health Help. Now, I couldn't find the position on their company website, so here it is on LinkedIn. This is a full-time remote position, and the qualifications are you must be an RN, LPN, or LVN, graduate of an accredited school of nursing, current active unrestricted RN, LPN, or LVN license in the state or territory of the U.S., which is nice because most companies will not hire you if you live in a territory of the U.S. So if you live in the 50 states or the states that are not Alaska or not Hawaii, they'll hire you. But a lot of times, companies won't hire nurses who live in United States territory. So that's a big plus. Moving on, minimum of 2 years experience in utilization review, case management, or clinical quality improvement, proficient technical skills in Microsoft Office, Word, Excel, and PowerPoint. And just a FYI, the companies I've worked for 3 different companies remotely. We've never used PowerPoint. And the ability to adapt to new healthcare specific software and systems required. And it does happen. Sometimes they decide to change the platforms they're using and upgrade their platforms, or just change the entire platform completely. Experience working with state and federal regulatory and compliance standards, that's preferred. Working knowledge of national coverage determination and local coverage determination. I do want to mention that even if you don't have this experience, look into your company's internal learning and development system. The same place you go to get your HIPAA, complete your HIPAA modules for your job, or complete any kind of job modules. Lots of companies will offer you free LinkedIn learning courses, and you may actually if you just type in national coverage determination or some of these keywords, and you may find a course on your internal, let's say, whatever company you work for, university's website with all the company modules and training modules. And you can actually add that to your resume, just a FYI. Knowledge of insurance terminology, good organizational and time management skills, excellent written and verbal communication skills, ability to utilize critical thinking skills, highly motivated self-starter who can work efficiently and independently or as a team member. And the start date for this job is May 4th. It is a training schedule. The first 6 weeks will be the weekdays, 8 a.m. to 4:30 p.m. And then the regular schedule after training, you'll be working 10:30 a.m. to 7 p.m. Central Time, and this is a remote job. And the salary for the LPN is $65,000, and the salary for the RN is $75,000. Moving on to the next job is with Advocate Healthcare. They have 3 positions here. This is a care manager RN, Atrium Health, remote in Mint Hill, North Carolina. It is full-time days, and this one is the same exact position, but it is part-time. So yes, you have a full-time position and a part-time position. So we'll go over the full-time position. It is remote, Wisconsin. The pay range is $38.20 to $57.30. It is a 40-hour per week position, and we're going to go straight to the qualifications. You must have 3+ years as an RN, experience in case management, triage or prior telephonic or remote experience. I would say for this job, you'll want to make your resume look as though you have remote experience, because whenever you are getting phone calls from or using your bedside phone, or sometimes they have little walkie-talkies, that's considered remote experience. Strong background in med-surg nursing with a cardiac stroke focus, Monday through Friday, 8 a.m. to 4:30 p.m. with the potential to include holidays. That's normal. Sometimes you'll have to actually rotate holidays and rotate weekends. The first company I worked with, they didn't require you to work weekends or holidays. It was only a requirement whenever there wasn't enough volunteers. But other companies, they just have it rotating, that way everyone gets a chance to work the holidays. This is a remote work from home position, must have high-speed internet, and you must live within 1 hour of Mint Hill, North Carolina primary care office. And the other position, that's part-time, pay range $38.20 to $57.30, and the qualifications are the exact same. The next position is a care transition nurse. This is full-time or part-time right here, and it is, the pay range is $35.50 to $53.25, and location is Rolling Hills, Illinois. And let's see, the qualifications for this position include bachelor's degree in nursing, typically requires 2 years experience in nursing in an acute care or community setting with an emphasis in palliative care or senior services, excellent written and verbal communication skills, strong organizational and analytical and problem-solving skills, ability to educate clinical staff in the community. You educate your patients. So that can be a translatable skill to educating clinical staff. Ability to work well with physicians and other healthcare professionals. Ability to work in a team-based multidisciplinary environment. RN license issued by the state in which a team member practices. May need to operate a motorized vehicle to facilitate home visits as appropriate. So for this position, it is not just remote from this location here, but you may also be doing some traveling to certain areas. So you're not actually remote at home, but you're remote at this location. Next, I want to mention, if you were to go to the description box below, you'll see a link, and it will take you here. I created this site. It's called Cure the Bedside Burnout. I have over 90 companies that hire nurses to work remotely. This is mostly in the United States, but some of the companies hire nurses in other countries, so Australia, Canada, the Philippines, UK, etc. Some companies are actually international. They hire nurses in several countries. And if you scroll down more to the bottom, you will see, almost there, you will see that you can do your own due diligence whenever you're doing your research on companies you want to work for. You can try, here it is, Glassdoor, Reddit. These are my two favorite Reddit posts, Remote Nurse Job Board and Remote Nursing. You can also look at Comparably, Teamblind, and Fishbowl. And then here I have, this is my Udemy course, the Remote Nursing, the Cure the Bedside Burnout. I include information about interqual, MCG, templates, interview questions, and more. And below that is a list of office essentials whenever you get your remote job. I highly recommend that you get one of these. This is a memory foam seat cushion. I've been having this thing for several years. It doesn't matter what kind of chair you have, your desk chair. You may decide to buy a cheap chair now and then upgrade later. This is perfect for whatever you are, no matter what kind of chair you have, this is perfect for your chair. And let's say you have to evacuate for some reason, let's say for forest fires or hurricanes. It's practical to take this seat cushion instead of taking your entire chair. Also, scroll down past that, you'll see a list of, I believe it's maybe 24 questions. These are FAQs about working remotely. And if you scroll down some more, keep scrolling, you'll see resume tips. So I always mention that you should add platforms to your resume. So not only Microsoft Office, but Epic, whatever platforms or software you use on your current job or previous jobs, add it to your resume. You want to promote your tech skills. Also write your resume with this in mind: what you did, why it's important, and how it relates to the job that you want. Because you want to make sure that your job that you currently have, the skills that you have now, translate to the skills that you will obtain at your new position. And here's an example: Proficient in electronic health record documentation to ensure continuity of care to provide insurance payer data to determine medical necessity. I'm going to explain that more further. And on the right hand side is a template. This is how my resume looks. I have my first and last name in bold, then the city, state, zip code, email. Make sure your email is professional, and then your phone number. You don't need your entire address. My education at the very top, and then professional experience. I highly recommend that you make sure your resume, your current job is in present tense and your previous jobs are in past tense. And also just make sure that you don't have your resume set up as all these tasks you completed. You want to make sure you focus on what you did, why it's important, and how it relates to the job you want. Of course, you want to focus on and promote transferable skills. Scroll down to more. You will see what a bedside nurse is versus an insurance nurse, and how what you do at the bedside directly relates to what is done as an insurance nurse. So a bedside nurse has a patient, an insurance nurse has a member, the same diagnosis. So all this information, all these things on the bedside were performed by different persons who are healthcare professionals. So the radiologic technician performs the abdominal X-ray, and then the radiologist reads it, and the patient is positive for bowel obstruction. And the doctor orders an NG tube to suction, IV fluid to 100 mL an hour, and NPO. On the insurance nurse side, the insurance nurse gets the clinicals, whatever people document or you're charting at the bedside, that's the nurses, doctors, whoever else is charting on that patient's chart, that actually transfers over to the insurance side. Someone sends the clinicals. It could be an insurance nurse on the hospital side, and they can send the information to the insurance company, and then the insurance nurse will review it for medical necessity. Now, I have it memorized with interqual. So the interqual criteria is the member must have the imaging positive for bowel obstruction. Doesn't matter where the obstruction is, it must be positive for bowel obstruction. The member must be NPO, NG tube to suction, and continuous IV fluids. Now, the insurance nurse, that's me, I could approve authorization for this member. That way the patient has their inpatient stay approved. And the bedside is not just in a hospital. That can be a skilled nursing facility, a long-term acute care, hospice, and inpatient rehabilitation, behavioral health. Behavioral health is when a patient is medically stable but psychologically unstable. So the same thing with behavioral health and inpatient rehabilitation, long-term acute care, and skilled nursing facility, as well as home health care. And if you look down a little bit more below that, you'll see what you do as a bedside nurse directly relates to what's reviewed by an insurance nurse. And where does the insurance nurse obtain clinical? From the hospital. The clinical is the charting done by the hospital staff. So that's you, the CNA, the doctor, the radiologist, whoever's touching that patient and putting information in their chart. That's useful information to the insurance nurse. And then these links are not, you cannot click on these links. These are just screenshots. But if you want to get interqual or MTG certification, just Google search interqual or MTG certification. You'll find these sites. Your commission is with interqual, and then MCG is with MTG.com. And if you decide to take one of these courses, they're the same price, and they're actually both live, delivered in real time courses. I have not taken these courses. I'm not promoting them. They're not paying me. The insurance companies I've worked for have taught us interqual and MCG. And I have more experience with interqual. But if you want to make your resume more marketable, then this is an option for you. And I think that's the end of this. Yeah, that's the end. So the next position is with Renal Logic. Now their online application looks a little bit different. You actually will click to apply here. But the position is a clinical care manager. The salary is $80,000 to $100,000 a year. It depends on your skills and certification. It is full-time and salaried. I don't like salaried because to me you can't increase your pay by increasing your hours. So if you want to work salaried, that's a good option for you. And for this position, you must live in Pacific or Alaska time zone. It says remote and minimal travel. And regarding the qualifications, you must have an RN license in good standing. Additional state licensure is a plus. A minimum of 5 years RN experience is required. That's bedside. Experience developing care plans for individuals with chronic conditions and our chronic kidney disease is highly preferred. Make sure you promote your CKD knowledge. Bilingual in Spanish is highly preferred. A BSN is highly preferred. A CDE or CDCES is highly preferred. Experience working 100% remote as a nurse is highly preferred. Ability and willingness to travel occasionally will include overnight stays for corporate gatherings, conferences, and health fairs. That's a plus if you like to travel. And ability to attend and professionally engage in video meetings. That's normal. Most companies, well, all the companies I've worked for, the three, we would use Microsoft Teams, and you would be trained on Microsoft Teams as well. So you would be your computer, your laptop, your 2 monitors, your keyboard, your mouse, your headset, which will look like this, or it could be, you could actually have 2 of these, and you may have a docking station which connects all of your equipment together, and sometimes maybe one of the monitors actually is a docking station. But anyway, the team meetings and the training will all be remotely. The first job I had as a remote nurse, we actually trained in the call center for the first 10 months. And then once those 10 months were over, we took all our equipment and brought it home with us. And we were home since then. And this position has a market competitive salary, so on and so forth. The next position is a clinical nurse navigator. The salary is $90,000 to $105,000 annually. This is a salary position, and the qualifications for this position includes RN license in good standing within a compact state, and willingness to pursue additional state nursing licenses as required. A minimum of 4 years nursing RN experience in a related role, clinical experience in oncology, infusions, or critical care, including care navigation, treatment support, and or complex case management is required. Must be in and able to work within the Mountain Time or Pacific time zones. Be able to speak, write, and communicate fluently in English and Spanish. Utilization review and or care management preferred but not required. Experience working 100% remote as a nurse is highly preferred. Ability and willingness to travel multiple times a year, which will include overnight stays for corporate gatherings, conferences, and health fairs. And ability to attend professionally engage in video meetings with other employees, clients, and members. Now, as a utilization review nurse, we very rarely have video meetings. We may have that once a week team huddle, but regarding video meetings with people who aren't co-workers or not your supervisor, that doesn't happen. Just an FYI. Reliable power and secure internet that runs at 11 megabits per second or more. A designated private area to conduct work with minimal interruptions is required. That means it's just HIPAA compliant. You want to be working in a room that has a door that locks. A strong technological skills, meaning you can effectively and efficiently use computers, peripheral equipment, and application systems, including Microsoft products, which is why you want to really promote your tech savviness. Autonomous self-starter who is comfortable with ambiguity and navigate change. Creative mindset and ability to appropriately challenge the status quo. Superb written and oral communication skills. Ability to overcome obstacles with a yes-if approach. And ability to effectively balance competing deadlines without losing focus on the bigger picture. And the last position is a clinical nurse coordinator. This is for LPNs. The salary is $40,000 to $60,000 per year, and this position requires LPN or LVN license and good standing within a compact state, and willingness to pursue additional state nursing licenses as required. 4 years. Looks like it's the same exact requirements as the previous position, and you must also work Mountain Time or Pacific time zone. Make sure your resume focuses on what you did, why it's important, and how it relates to the job that you want.